Hi, I'm Brandy Kirk from Kirk Center for Healthy Living and Kirk Integrative Physical Therapy. I'm here to discuss visceral restrictions. At the clinic we do visceral manipulation, so we work on your organs, and I thought it would be a good idea to describe what a healthy organ does and what an organ that has restrictions does and how that could affect your body, and then what actually causes these visceral restrictions. So a healthy organ, if we look at the liver as an example, is inside this organ, there's a lot of cells. There's a lot of tissue inside the organs that has a lot of cells, a lot of ducts. There's a lot of things inside here if we opened it up that actually does the 500 functions of the liver, right? And one of those functions is to create bile. That's going to go down to the gallbladder, and then from the gallbladder into your duodenum and your small intestine to break down fat. So the liver actually creates that bile. So there's actual cells and ducts and things inside this liver that create that bile. The liver also is a big detoxifier, so taking toxins out of the body is a big deal for the liver as well. And so there's a lot that's going on inside here. So a healthy organ, if we cut it open, the insides, all the microscopic cells, all the ducts that are inside of it, have to be able to slide and glide and move to do the job of that organ, okay? And so that could be the stomach, the liver, the gallbladder, the bladder, the uterus, the rectum, the intestines, pretty much any organ in your body, the heart, the lungs. There's actual cells inside that have to be able to slide and glide and move to do the job of that organ so that the organ actually functions properly. So that's inside the organ. Now outside the organ, we have a lot of visceral ligaments, and they're just like little connective tissue that connects this organ to another organ. So we actually have a connection between the liver and the stomach as an example. So there's some connective tissue that kind of comes from the stomach to the liver that actually has these guys connect to each other. So if there's restrictions here in that connective tissue that's outside of the organ, that's going to affect the functioning of that organ itself. So for one thing is the organs have to move with bodily functions, okay? So one of those functions would be about digestion. So the stomach here has to be able to do this little J stroke. So it has to churn like this. Well, if it's restricted against the liver and it can't come away from the liver, you're gonna have some problems with your digestion. And that could be just not breaking down food properly, or maybe having pain right after you eat, so that the stomach is not churning properly, okay? So this is just one connection. The other thing that has to happen with all of these visceral ligaments, so again, there's ligaments that go down into the large intestine, all kinds of organs are attached to one another. I'm not going to bore you with all of that, but there has to be enough movement that they can kind of move with the body. So for the liver, for example, if I rotate or kind of twist my body to the right, my liver has to be able to do that. If I rotate or twist my body to the left, it has to be able to do that as well. And if it can't do that, then it's going to affect the functioning of the liver. It's also going to affect how far my body is going to be able to turn to the right, or how far my body's going to be able to turn to the left. Because my brain is going to say, you know what, it's more important not to have stress and strain on this very important organ that does 500 functions versus allowing me to maybe have full motion of my back, okay? So this happens also in the pelvis, the hips, the upper back, the neck, all these different like musculoskeletal movements that we do. All of your organs have to be able to move with that. When you're walking, your cecum and your lower right quadrant has to be able to move forward and backwards. Your sigmoid colon down on the lower left of your abdomen and pelvis has to move back and forward as well. So there's all kinds of reasons why all of a sudden your muscles and your joints hurt and your muscles are tight, and they're kind of tightening up and guarding and protecting maybe an organ that's having some dysfunction. So a healthy organ should be able to move as I move in all different motions, okay? The other thing that needs to happen is when I breathe in and out. So when you breathe, the diaphragm muscle is a dome. And when you breathe in and you inhale, the dome inverts like this and pushes down. Well, what that does is it pushes the organs down in your body, and then as I breathe out, it comes back up and actually pulls those organs up. So the organs get pushed down when you breathe in, and then as you breathe out, they get pulled up. And so they have to be able to move with your diaphragm, or that's going to affect your breathing, which then affects the amount of oxygen in your body, and the list goes on and on. So healthy organs are able to move up and down whenever you breathe in and out. So all of your organs are moving up and down. When you breathe in, they move down, and when you breathe out, they move up. So those are healthy organs. When there's a restriction in the organ or around the organ, what can happen is this. If there's a restriction inside the organ itself, that means it's more of a cellular restriction, or maybe a lining issue of like the intestines or the bladder or the stomach, anything that has a lining to it. There's an irritation in there and it's caused a restriction. So that area inside that organ can't slide and glide and move and do its function. So then you get organ dysfunction. So for the liver, maybe there's a cirrhosis of the liver. Maybe there's a hepatitis C. Maybe for the stomach, we have problems with acid, and maybe it's producing too much acid or maybe not enough acid, right? So those are just some examples of a dysfunction inside the organ itself that would be more of a visceral restriction, okay? Now, outside the organ, if there's a visceral restriction outside the organ, so again, the stomach attaches to the liver, it attaches to your transverse colon, which is part of your large intestine. It kind of attaches up to the diaphragm, your breathing muscle. It attaches over to the spleen, which is on the left side. It kind of slides over your pancreas. So if any of that has a restriction in it, it can either affect the functioning of the organ itself, or all of a sudden your body is going to say, you know what, I'm not going to allow you to stand up straight. I'm not going to allow you to twist or turn. So all those functions we just talked about for the healthy organs is going to be restricted. Your breathing is going to be restricted because maybe this organ can't move up and down because it has a restriction on all those visceral ligaments around it. It's also going to be restricted with movements of the body, and then again, functioning. These organs have to slide and glide and move to do their job, and if they can't do their job, all of a sudden you have problems with the organ itself. And that may or may not show up in Western medicine testing. It just depends on how bad it is. Hopefully we get to it before it becomes diagnosed by a Western medicine evaluation or test. We hope that we can get it ahead of time. So with all these visceral restrictions, whether they're inside the organ itself or on the outside with all these visceral ligaments and connections, what actually causes them? So there could be a lot of different causes for visceral restrictions. One would be like a chemical diet. So if you're eating things that have a lot of chemicals in it, a lot of processed foods, that could really cause some visceral restrictions, especially inside the organs themselves. The other thing would be smoking. So smoking, we know, affects our tissues. It decreases the health of our tissues, the flexibility of our tissues, and it's not just the lungs. It's kind of a full body effect for that. When we do cadaver dissections of people who have been smokers versus non-smokers, the tissue integrity is definitely different. Drinking alcohol. I'm a wine drinker, so I'm not telling you not to drink alcohol. I'm just saying maybe do it in moderation, because it is a toxin, right? It is a toxin, and so you're having your body work a little bit harder to get rid of those toxins, right? Especially your liver and your kidneys. And so if you drink too much alcohol, there could be some restrictions that happen inside of those organs. Another reason for visceral restrictions is environmental toxins. So this could be the place you live, maybe the quality of the air. We did a cadaver dissection on somebody that actually worked in like a plant that had dye in it, and somehow the dye had gotten into their body, and so their organs were a different color. It was very interesting. And so, so all of that you're ingesting either through your skin or through your nose or your mouth, your organs are absorbing all of that. So that could cause visceral restrictions. The other thing would be poor nutrition. So any type of nutrition that's not actually adding to the health of your body, all those healthy greens and vegetables and fruits and things of that nature. If you're eating a lot of sugar, that causes a ton of inflammation in the body. So that could cause restrictions. Post-infection, if you have some type of like colitis that happens, if you have any type of infection in the body, parasites, any intestinal distress, anything that's going to cause some inflammation and then some scarring after the inflammation, that's going to affect how these organs slide and glide and move, and the insides of the organs as well. A hypotonic or hypertonic diaphragm, those are big words. All it means is either your diaphragm is too loosey-goosey or it's too tight. Okay, so either one can cause a problem with this kind of up and down movement, which kind of helps the functioning of your organs and the health of your organs. They actually need that. So big diaphragmatic breathing is very important for helping after we do our visceral manipulation treatments. Repetitive stress. If I worked in like a factory where I was constantly twisting my body to the right, I'm going to cause some visceral restrictions here on certain organs. There's going to be certain stresses and strains on the outside of certain organs, and those visceral ligaments are going to thicken up a little bit, and they're not going to allow that organ to move very well. Post-surgical, you could have the best surgeon in the world, the best surgeon in the universe, you're still going to scar down. That's how we heal as human beings. And so scar tissue prevents movement. And so we want to get in there, and it's not that we're breaking up the scar tissue, we're just trying to create flexibility through the scar tissue. But that could cause a visceral restriction is any type of surgery, whether you can see it on the outside of your body or not. You can have scarring inside, or you can have a visible scar. Those of you that have visible scars, that's just the tip of the iceberg. Most of those scars, they've cut through 6 to 8 layers of tissue, so there's a lot of scarring underneath that as well. Any physical trauma, that could be a fall, that could be if you are doing boxing or karate or anything that's more of a contact sport, football, anything like that, and car accidents are a big one. So just remember that energy is neither created nor destroyed, it gets transferred. And so if your car is going 80 miles an hour and it comes to a complete stop, all of your organs inside your body were going 80 miles an hour and they came to a complete stop. So like that force had to get absorbed. And a lot of times it gets absorbed by certain visceral ligaments in your body. And so we kind of know as specialists what those ligaments are. There's certain ones that really hold on for dear life, and they have a lot of tensile strength to them. And they'll cause problems because they will thicken up and tighten up, and they're not going to let those organs move. Another reason for visceral restrictions is emotional. Okay, so this is a little bit harder for some people to understand, but please know that if something happens to you and it's very emotional, your limbic system, which is the emotional system in your brain, can only handle so much. And if the emotional stress keeps happening or it's very traumatic, your brain will actually push that down into certain organs into your body. And there's been all kinds of study on what organs hold what emotions, and that's in acupuncture, and also the Brawl Institute, Jean-Pierre Brawl has studied this. They're pretty close to the same things, but any type of emotional trauma can get trapped in your organs and cause a visceral restriction, which then can cause some physical problems later in life. So all of these reasons that I just mentioned can actually cause visceral restrictions, because that's always the question when you guys come in. We find this restriction around your liver, and you're like, how did that get there? And so sometimes we know, and we're like, oh yeah, definitely that car accident probably caused this, and sometimes we don't. But these are pretty much the main reasons of visceral restrictions. So hopefully this clears some things up, and I hope you enjoyed this session.